Good afternoon, everyone, and welcome. Today, Orange County Mayor Jerry O. Demings will discuss the rise in positivity rates, hospitalizations, and the work of corporate organizations in our area and their work in combating the virus. The mayor will also enumerate his goals for the week and talk about the reconvening of the Economic Recovery Task Force. He will once again reiterate where you can get tested and the abundance of vaccine for all. We have lots of new cases of the coronavirus, and with that, the mayor will announce something of note. Dr. Valpino is here from the Florida Department of Health in Orange County, and we have Chief Judge Munyon. Lisa Munyon is here to discuss the court process here during the pandemic. Welcome, Chief. We'll begin with Mayor Demings. Mayor?
All right. Thank you, Dr. Williamson, and thank you to all of you for joining us here today. This week, we remain focused on fighting COVID in Orange County. Last week was a time for a reality check for our community. This week, much like 90% of all communities in the United States, our coronavirus cases are continuing to rise, and that signals an urgent need for our residents to get vaccinated. Since our last press conference, Advent Health moved to what they call black status, which means they are deferring non-emergency surgeries throughout their hospital system. And that is really tragic for all of our community. The hospital chain is moving from in-person visits to virtual visits for COVID-19 patients, and other hospitals have announced something similar as well. Last week, Orange County had 7,544 new cases. That surpasses the highest number of weekly cases from January of this year prior to vaccinations being administered. We have been participating in the nationwide COVID-19 wastewater monitoring program. Our utilities department has detected historically high levels of COVID in residential areas in eastern and northwestern parts of Orange County. On Wednesday, I declared a state of local emergency in Orange County, which continues through this week. I also announced a vaccination mandate for our non-union and union employees with some legal exceptions. Almost immediately, the region's largest employer, in fact, the largest employer in North America, the largest single-site employer, the Walt Disney Company, followed our lead. I'm also pleased that Disney and other public and private employers are stepping up and not only requiring patrons and employees to wear masks, but to also get their shots. We have faced this situation before, and together we can overcome the spread of the deadly disease by simply getting more people vaccinated and increasing the wearing of facial coverings. Because of the surge of the Delta variant and its rampant spread, earlier today, I reconvened the Orange County Economic Recovery Task Force so that our businesses could have a say in how we tackle this latest surge in cases. The last time the task force met was nearly a year ago, July 21st, 2020. We have been open since that period of time because we worked together to create protocols by which our businesses would re-engage and open and keep their patrons, their employees, and our citizens safe. We continue to endeavor to do that. Back then, Orange County led the way to get our businesses safely reopened. You may recall that we were an example around the nation and around the world where we had the experiment with the NBA, the bubble, and the Major League Soccer began right here that set the stage for how athletes would engage all over the country. Here are our goals. This is what we are trying to accomplish here in Orange County. Number one, to slow the spread of the dangerous COVID virus in our community. Two, make sure our residents know all of the free testing and vaccination site options in Orange County, including a new testing site in East Orange County. I'll talk more about that in just a few moments. Number three, continue to offer financial assistance to rent-stressed residents through our emergency rental assistance program. And number four, to continue to work with our businesses so that Orange County is not harmed economically by this latest surge in cases. There are now 169,745 reported coronavirus cases reported in this county. So nearly 170,000 cases. That's an increase of nearly 5,600 cases since our news conference last Wednesday. The Department of Health reports that yesterday there was 924 new coronavirus cases in our county. On Saturday, there were 1,610. That means we are still averaging 1,000 or better cases each day. Dr. Pino will talk more about that in his update. 12 more residents have died from the deadly disease since our last briefing on Wednesday. In fact, since our last briefing, we funeralized one of our correctional officers, a 40-year-old female who died as a result of COVID-19. The number of deaths in Orange County now stands at 1,402. Our 14-day positivity rate continues to rise. It is approximately 17.97% or 18%. We must work together in order to get these numbers down. As for the number of residents ages 12 and up who have at least one shot of the vaccine, the Department of Health estimates the number to be approximately 63%. Still, these are unprecedented numbers. I am announcing, consequently, the opening of a second testing site on the east side of Orange County. Starting tomorrow at 9 a.m., drive-through COVID testing is available at the Econ Soccer Complex on Yates Road. This site will be for testing only. No vaccination will be given at this time. The hours are from 9 a.m. until 5 p.m., 7 days a week. There is a 4-person limit per vehicle and no walk-ups will be available. We will continue to explore options for offering additional vaccination sites within the county. This will complement our busy Barnett Park location and hopefully relieve some of the stress on that site. And as it has been for the past year, Barnett Park is open 7 days a week between the hours of 9 a.m. and 5 p.m. The line to be tested has been closing early almost every day. There are no walk-ups, and we are limiting the drive-through to 4 individuals per vehicle. Barnett Park also offers both the Pfizer, Johnson & Johnson vaccines, so Pfizer and Johnson & Johnson. Countywide, we are seeing nearly 5,000 people a day getting the vaccine. That's good news because that's an increase for our community. 70% of those or better who are getting vaccinated are coming in for their first dose, and that is encouraging because that is a stark contrast to where we were just a couple of weeks ago. The federal eviction moratorium ended on Saturday at midnight. Just before midnight, it is important to know that Orange County's Emergency Rental Assistance Program is still available, and for those qualified residents, there is help there for you. To date, more than $5.58 million have been distributed to keep over 1,000 families in their homes. We're asking Orange County residents who are behind on their rent payment due to the pandemic to please consider making application through our website at ocfl.net/eviction or rental eviction program. The program may be able to help you pay 12 months of past due rent and 1 month of future rent, up to a total of $20,000. The program is available to all residents of Orange County except for those living within the corporate city limits of Orlando. Orlando administers their own program. That means if you live in unincorporated Orange County or live in any city in Orange County except Orlando, you are eligible for the county's program. Again, you can visit our website at ocfl.net/rental assistance to review program details. In addition, the I Got My Shot mobile vaccine trailer is coming to a neighborhood near you soon. Tomorrow morning, it will be at the Goodwill in Taft. Tuesday afternoon, it will be at the Rosemont Community Center. On Wednesday morning, the trailer will be on Moss Park Road at the new Bomberos Field Park. Shots will also be given at Lake Eola that morning. Then Wednesday afternoon, residents can get shots at the Smith Neighborhood Center on Bruden Boulevard in West Orlando. And finally, Thursday morning, the vaccine trailer will be at the Orlando City Hall. So there are little excuses if you're looking for a place to get vaccinated. Please avail yourselves of these opportunities that I just mentioned. And now I'll go to Dr. Raul Pino for an update as well. Dr. Pino.
Good afternoon. Thank you, Mayor. So the Mayor gave you an update on some of the basics numbers. Let me start with a few advice. So, we have recommended masking for those in indoor spaces that feel at risk. And you have heard the news about the recommendations from the CDC for everyone to exercise caution, especially in indoor spaces, due to the Delta variant. And we find ourselves into a conundrum here in the sense that we have done so well with vaccinations, and then come this Delta variant. Let me explain to the public a little bit what is happening with the Delta variant. So the period to get sick from Delta variants from when you get exposed to when you start feeling those symptoms is a lot shorter than with other variants before. So that is contributing to what's happening. Also, the amount of viral load of the viral that people shed when they cough, sneeze, talk is 1,000 times more than any of the variants before. And on top of that, the CDC has determined, based on the study that they did in CACOD, that people who are vaccinated and asymptomatic can transmit the virus from the Delta variant if they are affected. So part of the issue is also that if you are vaccinated, it could be that you are infected and not feeling anything, because the vaccine is protecting you not to get sick. And on that, the vaccine was never promised to prevent infection or to prevent transmission. What it was asserted from the vaccine at the beginning, and go back and see the videos and everything that we have done, is the vaccine will prevent you from getting sick, the vaccine will prevent you from getting hospitalized, and the vaccine will prevent you from dying from this disease. And all those is still true, even with the Delta variant. The vaccine continues to protect against getting ill. The vaccine continues to protect people from getting hospitalized, and the vaccine still protects people from dying. How we know that? Well, there has been all national studies and data, but we also conducted data analysis here, analytics, that from the 6th week after we gave the first dose, so we excluded everything that happened before anyone in the county got any full immunity. So we only analyzed everything after the first person had full immunity. It was found that 95% of all cases since February 6, I believe the day, I'm getting a nod in there. So all infections since February 6, 95% are among people that are unvaccinated. That we know historically in our records, it could be a few that we have record, things change, that could happen. But that 95 is a significant number. Even if we have a few hundred, it will not make much of a change in the 95. Also, not more than 95% of all people that has been hospitalized since January 6 were unvaccinated. And even higher than 95% of all people who die from COVID-19 since February 6 were also unvaccinated. So that's how we know the vaccine continues to be effective. And it is the only element, it's the only intervention, a clinical intervention in this case, is the only intervention that is going to take us off this train. The mask, the washing your hands, keeping your distance, those are mitigation efforts. The only clinical intervention that we have right now is that vaccine. Now, get vaccinated. Because I don't know these that are going to offer it right now. It was offered at the national level. I haven't read enough about this. But the variant is so aggressive that some of national experts are saying that everyone who is unvaccinated will get it at some point. So your odds right now are quite different than the way before, when people decided to wait a little bit and see, I can avoid it. This may not happen to me. It will happen to you. Today, the mayor just reported additional death. And those were 9 female and 3 male. 10 had pre-existing conditions, 2 didn't, and all of the deaths were from July 2021. Now, interesting, and that's what I bring that right now, for July 21, this month is the first month that our death is higher than the prior month. It's only by 1. It's not much, and it could change up and down as the state assign cases. But that's another interesting observation that we have gone through the data. Every single month since January, where we hit a peak on death, has been a decrease in the number of deaths. Also interesting, the median age for those who are dying is getting younger. So that age is getting younger and younger and younger. And it has to do a lot also that we have protected a lot. The older segment of the population, our vaccination rate are quite high among people who are 65 years and older. And we have seen a small increase in uptake of vaccines in our county. About 200 to 300 a day has been an increase, and that's encouraging. And also the fact that in children 12 to 17 years old, we are getting close to a little bit over 40%. So our recommendation is that for those who are eligible for the vaccine, please be vaccinated before you come to school. It is important to offer that protection to our children, and also we are protecting our family members. Those kids will be going back and forth between 2 different environments at all time, from a very crowded environment to a very small environment where we in many cases have multi-generational living. And when we had our peak in January and in February earlier this year, it was a lot of transmission among family members. And that is something that we are concerned. With positivity rate, our rate yesterday was 21%, 21.3. Now, Sundays are not the best day for a rate to have a picture of what's happening, because it tends to be a little bit higher than other days of the week. But our 14-day positivity rate is at 17.9. Only 6 weeks ago, that was below 5%. This is the speed in which we have transmission in our county. Our 100,000 case rate, and that means how many people per 100,000 are positive. Our lowest point was on week 24, 6 weeks ago, and that was at 52. 52 individuals per 100,000 were found to be positive in our community. Today is at 511. 511. We went from 52 per 100,000 to 511. And the cases that we are seeing are not the only cases out there. It's only what it gets reported. And this is not to scare anyone. This is to give you the truth so that you can make an informed decision. And that decision should be, if you feel at risk, if you are going into crowded environment, even if you are vaccinated, you should consider wearing a mask. And if you are not vaccinated, you should highly consider to get vaccinated as soon as possible. With regard to the variants, for the Delta, we have 269 cases confirmed and reported to the state, but those numbers are much higher. Some of the hospitals reported today that they are doing some sequencing to some of the hospitalized individuals, and they are finding very high levels. We also continue to see an increase in ER visits for COVID-19, and we are suspecting that it's going to be an increase in the coming weeks, maybe starting next week, on the number of deaths, because we have not seen those yet from this recent increase that we are experiencing. With that, Mayor, I would pass to our Judge, Lisa Millon. I didn't want to kill your last name because in Spanish would be differently. And I will take any questions after that.
Thank you, Dr. Pino. And thank you, Mayor, for inviting me today. My comments will be very brief. The Florida Supreme Court and the Ninth Judicial Circuit have taken significant measures to limit and modify court operations to ensure the safe administration of justice. So, masks are now required in all public spaces of court facilities, including all courtrooms and hearing rooms. Masks are available at the door if you arrive at the courthouse without one. Anyone who has tested positive for COVID in the last 14 days or who is under mandatory quarantine or isolation should not come to the courthouse. If you're a litigant, you should call your lawyer and ask what to do. If you don't have a lawyer, call the person that set the hearing and ask them what to do. Let them know what the problem is. If you are a juror, call the jury room and let them know that you've tested positive in the last 14 days or you're under mandatory quarantine or isolation. Whenever possible, cases in family, civil, and the dependency divisions will be done remotely. However, jury trials are continuing. We are bringing in fewer jurors, but to those jurors who have answered the call for service, I want to thank you. Without your participation in the civil and criminal justice systems, we couldn't do our job. So I appreciate the fact that you are showing up and we are attempting to keep you safe. And with that, Mayor, that's all I have.
Thank you, Chief Judge Munyon. By the way, Chief Judge Munyon is relatively new as the Chief Judge here in the Ninth Judicial Circuit. She took over, I believe, beginning July 1. And she is the first woman to ever have served as Chief Judge here within this Ninth Judicial Circuit. So congratulations to you, Judge. Also, to some may ask the question, how is it that the Supreme Court has the authority to issue a mandate that seemingly is incongruent with the governor's directive? Well, just as a reminder, here in Florida, there are different branches of government that have different authorities, and there's the executive branch, which is the governor, the legislative branch, but then there's the judicial branch. And as such, the Supreme Court, the Chief Judge of the Florida Supreme Court has issued the order in which Chief Judge Munyon here within our circuit has conveyed to you that is consistent throughout the state of Florida and puts our court system in a different position because that is a mandate from the Florida Supreme Court that is one of the few exceptions where the judge of the legislature does not have the authority over them. So, Chief, if there's anything I said just then that is not accurate, then you can certainly speak to that at this point.
Last Thursday, the Florida Supreme Court issued a new administrative order giving chief judges of the circuits the ability to respond to local conditions. And because local conditions in Orange and Osceola counties are at the state that they are right now, I issued an administrative order requiring masks to be worn. We are a different branch of government, and unlike other government services where you can decide whether you want to go to the tax collector's office or deal with the tax collector online, we force you to come see us. So because we force you to come see us, we have to make sure that we're doing everything we can to keep those that are in our building safe.
All right.
Thank you.
Thank you. In other words, in this instance, at the local level, they had a set of tools and procedures that the Chief Judge has availed herself of at this time. Also today, I want to acknowledge a couple of our commissioners, Commissioner Wilson and Commissioner Gomez-Cordero have joined us. If there are any questions for them or for our Spanish-speaking audience, Ms. Ilio Torres, one of my special assistants, has joined us today. I also have Director Danny Banks, our Public Safety Director and Deputy County Administrator, who joined us. And then from the schools, there may be questions for the school district. We have Mr. Scott Howard, who has joined us here, and he would be available to respond to any questions from the schools. And then from our utilities division, where we talked about some of the analysis that we have been doing, we have our department head, Mr. Torres, who has joined us here today. And so with that, I'm going to open it up for any questions that we may have at this time. And we are somewhere on this side of the room. Okay. Any questions for any of the speakers so far?
Mayor Lauren Seabrook, Channel 9. I was wondering if you could update us on maybe where you guys are at with the union employees in regards to negotiations for the vaccine mandate, as well as any response you may have to the large crowd that was shouting for you to come out just a little while ago.
Well, we are beginning that process of having collective bargaining conversations with the union leadership, and we'll see where that takes us this week. In terms of the crowd outside, I understand that maybe 30 or so people that are out there who are exercising their First Amendment right. They typically are taking the position that local governments shouldn't be involved in mandating the wearing of facial coverings or mandating that people get vaccinated or what have you. That's their opinion. But we're going to move forward to make our decisions in the best interest of the life, health, safety, and welfare of our residents here in Orange County. So with that would be my response to that. Okay, other questions?
Troy Campbell with Channel 6. This question is for you, Mayor. With the announcement of the second testing location, can you explain more of the process of selecting that location? What do you consider when you're picking a location to best serve the community?
Well, we look at the demographics, we look at the data, where we may be seeing outbreaks, et cetera. One of the things that you heard today was when we look at East Orange County based upon the predictive model that we use with the wastewater analysis is showing that East Orange is a location where we likely are going to see a corresponding increase in the rate of transmission for the virus within that community. So one, we want to be geographically located where we're going to do the greatest good. We also secondarily look for a facility that we can control, that we can facilitate the easy flow of traffic in and out of the facility. And we have done that. And then we look at the impact on our staffing, and we look at overall easy access for the general public. And so all of that is one of the reasons why we chose that location. Of course, we have been in the Barnett Park location for quite some time, and that primarily is in West Orange County, even though it has sufficiently served the entire county. We know from the zip codes that the individuals who have been tested or who have been given the vaccine at that location, that it has served all of Orange County, and in some instances people come from some other counties into our county to avail themselves of the service. So this will relieve some of the backup of the testing lines there at Barnett Park by opening the second location. Okay. Other questions?
Hi, Samantha Sosa with Fox 35. Mayor Demings and Dr. Pino, both of you feel free to answer this. You guys said that countywide we're seeing 5,000 people a day getting vaccinated. Can you talk about how that compares to, let's say, 6 weeks ago? And what are you guys seeing out there when you go to the vaccination sites? How are people reacting? Because, clearly this demand is huge compared to what we were seeing before. We were kind of seeing demand dwindle a little bit. So can you guys talk about that?
I'll defer to Dr. Pino on it. He studies with his epidemiologists the data on this hourly.
Could you repeat the first part? What side were you saying?
Countywide, we're seeing like 5,000 vaccinated a day?
No. It doesn't get to 5,000. When we were our highest, I was trying to pull the data, I have it on my phone. When we were the highest, vaccinating February, March, April, the highest days were a little bit over 10,000. The highest that we are getting at this point is around 3,000, sometimes a little bit over. Yesterday, I believe we did less than 3,000. We actually did analytics this morning looking at every month how the vaccines behave, but I don't have it yet in my mind. I haven't memorized it. I don't know if Albina has yet looked at that graph, no?
Yesterday was 1,600.
Yeah. So the numbers are still low, below 3,000 average per day if you go. And that number should be going around, 5,000 if we want to beat at this, which we can.
Dr. Pino, Emily Braun with News 13. I wanted to know if you can talk a little bit about pediatric hospitalizations. We're getting some tips that pediatric hospital wings are starting to fill up with patients. And so can you speak to any recent trends you've seen as far as upticks and even just cases among pediatric aged individuals?
So I will not be able to speak about the hospitalization itself in general. I can give you a number. But on Friday, I was talking to Nemours. Now, this is only for Nemours. It could be that, Advent Health has other pediatric hospital. But Nemours on Friday have 5 kids hospitalized for COVID-19. We are not getting the hospitalization data the same way that we did before. We are trying to re-engage in that daily hospitalization data. But for the number of cases, we have seen an increase in all ages, especially 15 to 17.
Matt from WESH 2, I have a question for you, Dr. Pino. To expand on the level of vaccination that we're seeing, I know there was a time when we were actually seeing more vaccinations of people from outside Orange County being vaccinated in Orange County. Has that trend changed at all recently?
No, we vaccinated so the county has given more than 1.4 million vaccines. Only less than 100,000, I believe is in the 80,000 numbers, were for non-residents. We also conducted additional analytics and realized that we have given about a little bit over 8,000 doses to international individuals. It doesn't mean travelers. It means someone that gave an address outside the United States as their address. And that had happened. Probably have to do a lot with the vaccinations that we were doing at the airport. And it's also important for people to know because we have a high number of people that only have 1 dose. And it's important for people to know that no matter when you have that first dose, you can go for your second. You don't have to restart the series. So even if you have your dose in January, go and get your second one. It's important to get that extra 40%, 30, whatever percent that the second dose will give you in protection. And again, if you have your first dose, no matter when it happened, you can have your second without needing to reinitiate the vaccination schedule again.
Questions for Dr. Pino. Nikki Zizaza with News 6. Dr. Pino, you're urging staff to return and making sure that they're vaccinated. Recently, the Florida chapter of the American Academy of Pediatrics also encouraged, children under 12 years old to make sure they're wearing masks. In terms of the risk, you talked about transmissibility with the Delta variant. For parents who are still trying to decide exactly how they should approach this, what should they be thinking about before sending their kids back, and even some of the staff at school trying to decide whether to get vaccinated because of all the mixed messaging?
So I think, younger than 12, the challenge that many parents are having is that there is no vaccination for them yet. And many parents would like to have that. That probably will come in the winter the national leaders are saying that the vaccine could be authorized, emergency authorization for children, probably by December. So that's when we probably will engage in protecting younger than 12 with a vaccination. Now, what parents have to realize is that, this is a multi-layer approach. The mask will not do it by itself. The vaccine is the remedy for what we are experiencing. But besides the vaccine, the mask will not do it by itself. Washing your hands will not do it by itself. Keeping social distancing will not do it by itself. It has to be all those measures, and not in one place, but everywhere. Meaning when the kids go back home, they have to wash your hands. You need to, if you have grandparents or people with pre-existing condition, also protect those individuals, but also try to vaccinate everyone in the house that is older than 12. That's another way to protect that child that cannot have access to the vaccination yet, and also to protect the individuals that are home. So by getting vaccinated, we have said many times, you're not only protecting yourself, you're also protecting those who surround you, because it's less likely that they will get it from you.
I'll just double check. Mr. Howard from the school district, would you like to make any comments on behalf of the school district? Good. He's good. Okay. All right. Next question.
Thomas here with Florida National News. This question is for you, Mayor Demings. This is in relation to the rental assistance program. Obviously, as it relates to the COVID-19 vaccines, there are a lot of ground game initiatives to get folks vaccinated. As it relates to getting more word out about the rental assistance program, you guys going to do anything to keep that up? Because even on the national level, there are a lot of cities and counties that receive the federal money, but the residents still weren't able to take advantage before the moratorium ended. So is there something additional that you guys are going to do to get the word out for more residents to take advantage of Orange County's funding?
Well, in light of the fact that the moratorium just ended this prior weekend, what we're trying to do is accentuate the fact that there are dollars available for persons who have been impacted by COVID. And so we will use our social media platforms. We will work with you, our media partners, to help share this news. Last week, I had a conference, a web conference with members of the faith community, and we shared with them about the opportunity, and we also did a training exercise with social service providers here within the community so that they are as much aware of what opportunities we have as possible. So we're going to continue to do those types of efforts to collaborate with our community partners to spread the word.
Buenas tardes, Félix Pirela de Telemundo. Mi pregunta es para el doctor Raúl Pino. Doctor, quisiéramos saber cuál fue la edad promedio de muertes y hospitalizados del pasado mes de julio acá en el condado Orange, si la tiene a mano. Y la otra pregunta que quisiera hacerle es cómo va el proceso de aceptación de un sector de los latinos que todavía se resisten a las vacunas. ¿Ha ido creciendo el porcentaje de inmunizados de nuestra comunidad latina del condado Orange en las últimas semanas?
No tengo la respuesta para ninguna de esas dos preguntas, porque no tengo los datos aquí delante de mí. No te las puedo responder realmente y te pido disculpas por eso. So the questions were if I have any indication that has been an increase in the number of Latinos getting vaccinated, and also, what was the second question? ¿Cuál fue la segunda? And I said that I don't have the answer to those questions, as I don't have a specific data for Latinos in front of me.
This next question comes in from Ryan Gillespie with the Orlando Sentinel. This one is geared to you, Dr. Pino. His question reads, within this surge, what kinds and roughly how many outbreaks are you monitoring currently at workplaces, living spaces, etc.?
So I don't know on the top of my memory. We have a listing of outbreaks. They are all in different phases, so it would be unfair to just give a number because we follow outbreaks up to 2 weeks after we see the last case. 2 or 4? 4. 4. After we see the last case. So we wait for a complete cycle of non-cases to close an outbreak. So it could be many of those outbreaks that are already in their way out. But we have seen outbreaks in all areas. We have seen now let me say this, for assisted living facilities, even one case is considered an outbreak because they need to have a quick and rapid intervention. So even if we have one single person in one of the assisted living facilities, that is considered an outbreak, in this case, to be able to act quickly. But we have seen it in restaurants and bars. We have seen it in everywhere. It's just everywhere. It's wide, and that's what the CDC call it. It's wide community distribution.
All right, that appears to be the last question of the day. The next press conference will be on Thursday at 4:30 p.m. If nothing changes significantly between now and then, we'll see you all back here and we'll give you an update. Thank you for attending.